Hi, Tricia. I'm Dr. Kavali.
Nice to meet you.
Nice to meet you too. Thanks for coming.
Sure.
So I've gone through your medical history, and you're young and healthy, so there's really nothing there, and that makes you a good candidate to be here from the get-go. So just tell me what brings you here today.
Well, I have always had a problem area. I'm on the outside of my hips. I feel like my hips have always been bigger no matter how much weight I lose or how good shape I'm in. So my outer thighs and my inner thighs, I always feel like my inner thighs touch. They're always rubbing together.
So for the problem areas that we're talking about treating for you, the inner and the outer thighs, liposuction is a great option for you. The liposuction that I prefer for you is going to be lipocontrol. It's a laser-assisted liposuction that actually uses a GPS sort of format so that we can visualize the treatment on a screen as we're doing it.
Okay.
And the way the laser-assisted liposuction works is it's here in the office. It's under straight local anesthesia. You're awake. We do give you a little Valium so it kind of takes the edge off, but you're still awake for the procedure. You're able to talk to us. We let you pick your own music for the eyes. So the first thing we do after you're comfortable and in position is we get you numb. Little stick and a burn just like you would have at the dentist, only not even that bad.
Okay.
Right in the area to be treated. And then we make tiny little incisions that you're not going to feel because you're numb. And then we put more numbing fluid in underneath the skin. So it kind of feels like you're getting blown up like a balloon with the numbing fluid. It gets a little tight, but it stings just for a few seconds, and then you're numb. And then the next thing we do is position the lipocontrol device so that we get our mapping situated. And then through those tiny incisions that we made, we pass a laser fiber. And we can see what we're doing, and you can even see it on the screen. And what it shows us is that we're giving your treatment area an even disbursement of energy. So it avoids hot spots, it avoids divots, it avoids areas that are undertreated. So it helps us get a nice smooth result, and that's important for someone like you when you've got just a little problem area. Those actually are sometimes harder to do a good job contouring than a larger area.
Is the fat gone for good, or does it ever come back?
The fat is gone for good. First of all, the laser energy literally destroys the fat cells. And then the next thing we do is suction out the fat cells that have been destroyed and some of the cells that are around them to contour the area. So those fat cells are gone forever. The whole procedure should take about an hour or so in the office. We'll start side to side since we're doing outer thighs.
Okay.
So you'll go from hip to hip, and then we'll finish with the inner thighs with you just lying on your back. Afterwards, we do close the incisions with little sutures because a line makes a prettier scar than a hole.
Right.
So we do close them with a couple of little stitches. We put little dressings on, and then we put you in a compression garment. So you leave immediately, and you get up, walk out with the compression garment already in place. The compression really helps to squeeze out some of the swelling that's going to accrue on a day-to-day basis, and it does help some with your final shape to see it more quickly.
Okay.
But you're not going to do any irreversible harm if you don't wear it for a day or two. So cheat days are okay.
Do you wear the compression garments at night when you sleep?
You do. That's actually the best time to wear it.
Okay.
You can expect to be swollen for a long time.
Okay.
Just know if your pants are tight, your dresses aren't fitting right, it's impossible that I've made you bigger by doing liposuction, okay? So anything that's bigger or tighter is swelling, and it will go away.
Okay. How about recovery time?
Recovery is very quick. It feels kind of like a bruise. Even if it doesn't look bruised, that's how it's going to feel.
Okay.
And bruised in the treatment area and adjacent to the treatment area. So just a little bit lower on the leg, you may feel a little bruised. You can get back to exercise, though, within a week or so, maybe even less than that.
Okay.
The jarring of running might be a little uncomfortable to start with, but you can absolutely do it.
Okay.
Any other questions?
That's it.
Great.